Hey, this is Dr. Jeff Dugas coming to you from Birmingham, Alabama. I am an orthopedic surgeon specializing in sports medicine and the fellowship director at the American Sports Medicine Institute. You are listening to Interview with the Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, welcome Dr. Jeff Dugas, orthopedic sports medicine specialist at Andrews Sports Medicine. Doc, how are we doing today?
Doing great. Thanks, Matthew.
Thank you for being with us. So, getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
Well, I did my residency at HSS, so I was surrounded by amazing kind of all the time. And I enjoyed every rotation, and I gravitated towards sports pretty early because of my experience with John Fagan at Duke, who was really kind of my original orthopedic dad, I would say. And then I went up to New York, and I'm surrounded by Warren and Wickowitz and Joe Hannafin and Alchek and all these guys, Wickowitz, these people that are just incredible. So, I really gravitated towards them because they're such good physicians, but they're also good surgeons. And I always liked the idea of not just being a good technician, but really being a good physician. And I liked the idea of working with sports. And so I gravitated towards that. And so as the years went on in residency, I still liked some other things. We got really good experience with joints and sports and trauma with Helfet and tumors with John Healy at Sloan Kettering and all these things. But I just kept gravitating back to sports.
So taking us through that fellowship year, what was your mentality heading into your first job search, and how that perspective changed in the beginning years of your career?
So as my wife and I drove across the Georgia-Alabama border, pregnant with our first child, very pregnant with a dog in a U-Haul, after leaving the Upper East Side of Manhattan in tears for a place that my wife had never been to. And I promised her with everything that I held sacred that we were going back to the Carolinas where we both grew up. And then about 3 months into the fellowship, Dr. Andrews asked me if I was interested in staying in Birmingham and joining the practice. He had never added a partner. And Lyle Kane and I were fellowship classmates, and he asked us both if we wanted to stay. Lyle grew up here, and so we were kind of side by side all the time. So we talked about it, and we thought that'd be great. 6 months goes by, and we didn't hear anything really from Andrews or the group. So Lyle and I both went out and found jobs. I had a job in Florence, South Carolina, where I had actually signed a contract. And when Dr. Andrews got the paperwork for me to have privileges at a hospital in Florence, he called me in and asked me what was going on. He thought I was staying. And I said, Doc, I got to have a contract. And he said, his contract when he was working with Jack Houston was a handshake. And I said, man, I got to have a contract to buy a house. I can't borrow money without a job and a contract. So we were offered a contract the next day, and Lyle and I stayed, and I paid the guys in Florence to get out of the contract I had signed. And, I was looking for geography, first of all, to be closer to family. We had a child when we were fellows, and having a kid in fellowship with no family around was tough. So we were going back closer to family. I wanted to stay in the Southeast. I wanted to have a sports practice, which was going to be what Florence was also. But getting the chance to stay here was too good of an opportunity. And, even if it didn't work out, I knew it would be a great stepping stone to something else, having been part of this practice with Dr. Andrews. But the plan was we prioritized geography to some extent and the nature of the practice. And obviously being in the practice here, the nature of the practice is fantastic. And I convinced my wife to give it a chance, and we've been here for 22 years. So, and I don't think we'll ever leave.
So during the whole process, did you ever consider going academic, or were you really private practice focused all the way?
No, I was considering academic, and obviously I'm doing kind of privatemics here. We teach, we do a fair amount of research, we write, we do all that stuff, but not in a university setting. We have appointments at UAB, so I do, and I work with colleges and things like that. So I do have a fairly academic practice, but in a private practice clinical setting, which to me is the perfect model. I did look at academics. I looked at going back to Duke, where I'd done medical school. I looked at some jobs in the Carolinas. It just didn't I didn't feel like the clinical side of it was enough for me. I wanted to really be a clinician, and having been here for a year, to get offered that opportunity kind of made it easy for me not to look that hard at pure academics once Dr. Andrews got into that, which was pretty early.
So thinking back, what would you say were some of the keys to your success that shaped your early career as you climbed the top of your industry?
Well, definitely standing next to a legend every day for 10 years helps, and there are some upsides and some downsides to following a legend. One of the real upsides is that you get to learn, and you get to see things, and your experience grows. So, Dr. Andrews did 1,200 cases a year, and I scrubbed on half of those, and Lyle scrubbed on the other half for the first 6 or 8 years of our practice. So in addition to building our own clinical practice, we scrubbed on hundreds and thousands of cases with him over the first 6 or 8 years, and learned to teach fellows and learned what it was like to work with people in training. And that was just an opportunity that came to us. It wasn't something that I necessarily sought out, but that experience of being next to him and Bill Clancy, our two mentors, was unreplaceable. And we got to do enormous volume and do it in a setting that we could learn, as well as learn how to handle big volume and learn how to handle teams and agents and coaches and players and families and all the communication that goes along with that. So, we were building our own practices, but we were doing so much more than that, which was just an incredible experience and opportunity that was unreplaceable. And it really accelerated our learning experience as you go into practice, which is something I would say to anybody young. It's a process. It'll take you 10 years to get to the point that you really are at steady state. And we have new young partners in our practice that, they want to grow and they want to get busy and they want to be busy right off the bat. Once they get to about 8 or 10 years, they finally realize that they're glad they didn't get, you know, 600-800 case practices in their second or third year, because they wouldn't have handled it well. They wouldn't have handled, the complications. They wouldn't have handled the results. And you really have to have some maturity and experience to be able to handle those things. So, being able to experience that without, having it all be on us right off the bat was a huge benefit to the two of us.
Now, in those beginning years, as you're kind of getting started in your practice, obviously being next to Dr. Andrew was a big thing. But was there anything that you went through personally that maybe would have done differently now, looking back with all the experience and knowledge you have today?
I also had Lyle. So having a brother, somebody going through the same thing with me, we talk now a lot about mentoring and having somebody to look out for you. Having somebody like Lyle, who's one of the closest friends I could ever have on this planet, but really we treat each other like gold. And having a brother going through the same thing was great. So I would tell you that having somebody that you can really talk through things with, that knows what you're doing clinically, that knows the difficulties, knows the hassles and all the ups and downs of what we do as orthopedic surgeons, whether it be hospital issues or administrative issues or insurance issues or practice issues or whatever complications. Having somebody that you can really sit down with as a mentor is a good thing. And I had Dr. Andrews, but I also had Lyle. And I know he would say the same thing about me, because we still do it 22 years into it. I would also say that some business experience, we were fortunate enough to have hired in the last 10 or 12 years one of the top CEOs in orthopedic practices, and that's Lisa Warren. And you don't realize until you have a really good practice manager, a really good CEO, you don't realize what you don't know. And as surgeons, you tend to think you can fix things and that you're good at a lot of things. Lyle and I realized very quickly that we were not good at that stuff. So I think being humble about what you know and what you don't know about running a business as a surgeon is super important. And you have to place your trust in people to do those things. So hiring people to do the billing and coding, and people that really know that stuff and know it forward and backward, knowing people that can run your business office, knowing the people that can do HR. I'm not a good HR manager, and I'm not a good biller and coder. I'm not a good accountant. I'm not a good CEO. I'm not a good any of those things. I'm a good surgeon, and it's best if I just stay in that lane I'm doing the best I can for everybody when I'm wearing these things, not trying to play businessman. But I would say that, today's young orthopedic surgeon could certainly benefit from some business experience, some business classes, some business management classes, things that I didn't have. Lyle and I learned those things the hard way a lot of times. And there are definitely shorter paths to learning those things than the path that we took.
So having one of the top fellowship programs across the country, what advice do you have for them when they're talking about entering the professional job market for the first time?
We talk to our fellows. We have 6 of them every year, and we think of them like our children. We spend so much time with them that you have to train them. Sometimes you got to discipline them. Sometimes you're disappointed in them, but you really want them to go out and make you proud like a parent. And you want what's best for them. I tend to tell them, you got to prioritize. You got to create a priority list of what you're looking for. Are you looking for dollar signs? Are you looking for the type of practice you're going to have? Are you looking for a supportive environment? Are you looking to be independent? Are you looking for geography? Are you looking for a certain size of city? How far do you want to be from water? How far do you want to be from the mountains? How far do you want to be from family? These are all things you have to consider and prioritize. And if you can kind of prioritize those things, then you can start searching and narrow your search down a little bit. And I would tell everybody, go on 5, 6, 8 interviews, because just like when you interviewed for fellowships, if you don't do 8 or 10 of those things, you don't know what you're looking for. You have to do some of them to see the differences between them. If you only do 2, you're only going to get 2 perspectives. Now, if you're dead set on being in a certain town, you may have to accept some of those other things as, they may not be ideal. If you're dead set on academics, you may have to accept maybe not the perfect geography. So you have to prioritize those things and then go and see what the different models are. Every practice has a different model. Every academic setting has a different model for how you get paid, how you work, what your time is done, how much time you do in research, what your clinical support is, what's your ability to hire people to help you, what's your ability to go out, what are your resources to go out and get team coverage opportunities. Are they going to support you in that? Are they going to financially support it? Do they support the athletic trainers or an outreach program? Now, these are all things that you have to look into. And if you don't cast a little bit of a broad net, you're really not going to have a perspective on what you're getting offered. So I would tell them one of the most important things is to go on some job interviews, even if you don't think that's perfect for you. Go get some experience asking the questions and ask the tough questions. People think mostly doctors don't know business. And for the most part, they're 100% right. So you have to be willing to ask the questions that a business person would ask. And you can't shy away from asking them. And there's some important questions to ask. How are patients going to come find me? What is the practice going to do to promote me? Is it the phone rings off the hook like it does here, and all you got to do is have a pulse and you're going to have a practice? Or is it you got to have, there's a concerted effort to promote the new guy? What is your competition? And the other thing I'll tell you is no matter where you go, don't go in guns blazing and think you can outperform everybody. Go in and be a gentleman or a gentlewoman and really make colleagues in the community. I can't tell you how many times I've heard stories about how somebody went into a community and really got sideways with some people. And when there were opportunities for them to merge or go to a different practice, those opportunities were lost because of how they handled it on the front end. Go in and be respectful of the people that are there. They may be better than you think, and try to make good relationships with other people in the community in the same profession.
So kind of on that mindset of your fellowship program, what are you actually looking for when candidates are coming in to interview before you select who those are going to be?
I'm looking for maturity as much as anything. And I kind of classify that as people who understand what a fellowship is for. When I'm interviewing fellows and they're wondering how we assign cases, those people are thinking like 4th-year residents or 3rd-year residents who don't get to do a whole lot. We've already told them that the volume here is ridiculous and you don't have to worry about that. But if you're worried about how we assign cases or how many of this you're going to get to do, you're not paying attention. This is a pre-job year. And this is the year that you hone some skills and get ready for your practice. So I want the people that are thinking like that. I want you thinking like a fellow when you're interviewing. And the things that I like to see are, you know, how does the practice, how does the fellowship work with the current fellows on placement for jobs? What are the resources we have available to us? More importantly, what do they do for us when we leave? How involved are they? How willing are they to be involved? Um, what resources are available to us once we're out? And how do you what are the educational opportunities? What are the research opportunities? Those kind of things those are fellow level questions. So I'm always looking for the people that are thinking like a fellow, not thinking like a fourth year resident when they're interviewing.
So deal with the pandemic in 2020, now also now in 2021. What advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
Virtual stuff is here to stay. And, I think everybody that at this point is pretty savvy at that stuff. If you're not, you should be. Virtual patient care, virtual evaluation of records, all those kind of things. I would say that one thing I would always say is don't let technology take the place of quality. There is no substitute for doing quality work. I would rather see, and I tell our young guys this that are in our practice and our fellows, it's quality over quantity. The quantity will come. Don't let anything help you to suffer quality issues. You will get sidelined quickly, and you will wish you hadn't done that. So at all costs, you have to do the right thing and you have to do it well. And I would tell you that doing what you're good at as you get started is more important than doing a lot of things. The more complications you have early on, the tougher it's going to be to build your practice. So stick to the things you're comfortable with. And if virtual technology is part of that, great. If the pandemic continues and we have to do a lot of this stuff virtually, so be it. But every chance you have to be in person, to deal with someone in person rather than having your staff deal with it, you want to take that opportunity early on.
Now, being the fellowship director of AOSSM, what type of resources are you providing to the next generation? And also, what initiatives are you really excited about?
So, as the director of the fellowship committee, or chair of the fellowship committee, we instituted a lecture series, two of them actually, that have been gone out to all the fellows. It's free. We made membership in AOSSM free through a grant from OSER. So we've tried to include all the fellows across all 220 something fellows in all 95 programs. We have professional development stuff that we've done for the fellowship directors. So for the program directors, we've had some professional development stuff for dealing with the pandemic, for virtual this. That mental health, we did a thing on mental health with the program directors, because we knew that there was pandemic fatigue among the fellows and the residents. So we've done a lot of that stuff. We're continuing to do that. We're as part of the fellowship committee, I also sit on the education committee, and so as we plan educational events coming up, we're really being sensitive to what the needs are of people who haven't been able to attend courses in the past. And the fellows this past year plus, was their experience uniform? You may be in a fellowship where there really wasn't that much disruption in volume, but if you were in a place where you really didn't get to do half your fellowship and there wasn't a lot of clinical volume, that's a problem as you go out into practice. So we need to create courses that address that and provide opportunities for the fellows who maybe need some extra work or extra time in the lab. So we're working on those things as well.
Can you also talk about your involvement with professional sports and also different sporting organizations out there?
We work with a lot of professionals here, even though we're not necessarily listed as their team physicians. We are very happy to have great relationships with the major sports and the players associations through their collective bargaining agreements in all the major sports. So we work directly with some. Dr. Andrews is the team doc for the Redskins. He has a relationship with the Saints in the football world. Obviously, the colleges, we take care of 9 colleges in Alabama, including 4 Division I schools, some of which have won a lot of championships lately. The Roll Tide. Um, I take care of Troy University. I have for 22 years. I also work with the Birmingham Barons, which is the AA affiliate for the White Sox. So I work with the guys in Chicago quite a bit, Nick Verma and Greg Nicholson, Chuck Bush, Joseph, all those guys. Um, we do a lot of high schools around here. I think we take care of 50 high schools around here. I'm also the medical director for USA Cheer, which is the national governing body for cheerleading, based out of Memphis. And I'm the co-medical director for WWE, which is an interesting thing. I've worked with them for about 15 years, and they're a fun bunch. It's one of my favorite professional relationships. I thoroughly enjoy working with them.
So now for the new docs coming out, sports medicine docs, what advice do you have for them as far as how should they be interacting with, let's say, high school athletic directors or even agents if they know, or, ways where they can network themselves within that sports community?
I think you have to be careful with that early on. There are plenty of high schools that don't have a team physician. So my advice would be go find one of those, even if it's an hour away. That's what I did. I found a high school an hour south of town, and I still take care of them. And they've grown. They were a small school when I started 22 years ago. Now they're pretty big. Coaches move around, and if you do a good job, those coaches that move around, they'll come looking for you when they get to their next job. So I would tell you, first of all, start with a place that you can provide a service. When you're the team doc, you're there to provide a service. You don't own the kids, you don't own the team. You're providing a service, and you should provide it for free. They may give you a spot in the program or some advertising, that's fine. And you should do their physicals for free. You should show up and do them. Get a team of people to go do their physicals for them. Be willing to answer the phone and say yes. They need somebody to get in tomorrow. The answer is yes. I think something that we do here better than most places is we say yes to everything. So I would say that, if there's an opportunity to take care of a team, if a team puts out a request, say there's a minor league baseball team and they're looking for a new team physician, it's reasonable to get the group together and say, look, I'd like to throw my hat in the ring for this. Make sure you're not stepping on one of your partner's toes. You may have a partner that's already doing it. And if that's the case, ask them if you can help them. Say, look, I'll be happy to cover a few games for you. Just to get to know what it's like and what the work is and what the demand is, just to have your name in there. And it's fun to do. Take your kids, do that kind of stuff. In terms of professional athletics, there is not really a lot of young people that are going to get into professional athletics that quickly. And that's because the professional organizations have a certain level of standard. You have to have the certification, the specialty, subspecialty certification to be listed as a team physician for most of the pro organizations. So that takes a couple of years. But I would tell you not to go in and say, look, I'm going to live in this community and I'm going to get that high school right there. There's probably somebody doing that. And so find out what the lay of the land is. Go and talk. If you want to go meet with the AD, you can do that. A lot of times that may be seen as hostile by the other person that takes care of them. Be supportive, offer to do things for them. If there's an opportunity to sponsor something, sponsor it if you want to. Sponsor a team, do it personally. But, I don't think that there's ever a time when there's not enough schools that need coverage. There are lots of schools that don't have a team physician. Start there.
Now, with your name being really a household name amongst the orthopedic community, has there been a moment in your journey so far that you really look back and said, you know what, that's something that I really look back and I'm really happy about that? Or was there a decision you made throughout your career that allowed you to be to where you are today?
I think the decision to take this job was probably, the most important one to get Tracy, my wife, and make the decision to keep our family here was obviously a key decision. And to stick it out, the first 8 or 10 years working really hard, doing a lot of work with Dr. Andrews and trying to pound out research and, same time trying to raise a family. And I would say that, the decision that I made, I remember John Fagan telling me, I don't know, probably 6 or 8 years into my practice that I better slow down and make sure I do all the right things at home and stay involved with my family. I can be busy my whole life, but I'm not always going to have a chance to be a parent. And I really took that to heart. And after about 6 or 8 years, I started taking Fridays off, just to give myself a break and do some things. Make sure I took my wife out to dinner and make sure I coached my kids' baseball team and all those kind of things. And so I think that balance is really something you have to work for. And you can be really busy and you can be really successful, but some of the most unhappy people I know are the people who lost track of that balance. And every time I've made a decision to maintain the balance, those are turn out to be some of the best decisions I've ever made. Getting involved with AOSSM is something I encourage people to do. It's a tremendous organization that really does have an interest in fostering and nurturing the young sports medicine specialists. It's our trade organization as sports medicine docs. And as a member of lots of different organizations, I will tell you that AOSSM, it just has a different mentality about things. I'm a member of the Arthroscopy Association, shoulder and elbow. Those are great too, and I encourage people to do those things as well. AOSSM really is sports medicine. And so if you're going to be a sports medicine specialist, I encourage you to really get involved with AOSSM, pay attention to what they're doing, volunteer for a committee, come to the meetings. It is our trade organization. And as a sports doc, it just doesn't get any better than that.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.